Have you ever woken up multiple times during the night, desperately needing to use the bathroom? Or perhaps you find yourself rushing to the restroom even when your bladder doesn't feel particularly full. If so, you're not alone. Millions of men experience these frustrating symptoms, often related to an enlarged prostate. Today we'll demystify this common condition, benign prostatic hyperplasia, or shortened BPH, and we will explore how to manage it. Gentlemen, let's talk about something that affects millions of men worldwide, yet often remains shrouded in silence: an enlarged prostate. It's a topic many men avoid discussing, but understanding the basics of benign prostatic hyperplasia is crucial for maintaining your health and well-being. Picture this: a tiny walnut-sized gland nestled just below your bladder. That's your prostate. It plays a vital role in reproduction, producing fluid that contributes to semen. As we age, however, this gland can sometimes grow larger than it should. This enlargement is what we call benign prostatic hyperplasia, and it's important to understand benign prostatic hyperplasia itself is not cancer. While it's not cancerous, benign prostatic hyperplasia can sometimes coexist with prostate cancer, underscoring the importance of regular checkups. Now, what increases your risk of developing benign prostatic hyperplasia? Age is a significant factor. The risk goes up substantially after age 50. Family history also plays a part. If your father or brothers struggled with benign prostatic hyperplasia, your chances of experiencing it increase. Lifestyle choices also make a difference. Being overweight or obese, leading a sedentary life, and having erectile dysfunction all increase your risk. One of the earliest and most common signs of benign prostatic hyperplasia is a change in your urinary habits. This often manifests as urinary frequency, needing to urinate more often than usual, especially at night. Why does this happen? The enlarged prostate puts pressure on the urethra, the tube that carries urine out of your body. This pressure makes it harder for urine to flow freely, causing your bladder to work harder and fill up more quickly, leading to more frequent trips to the bathroom. This increased frequency might even occur when your bladder doesn't feel particularly full. It's important to note that frequent urination isn't exclusive to benign prostatic hyperplasia. Other conditions, such as urinary tract infections or bladder stones, can also cause this symptom. That's why seeking professional medical advice is crucial for an accurate diagnosis. Have you noticed changes in your urinary habits? Share your experiences and any questions you may have in the comments section below. We can learn from each other's experiences. And remember, regular checkups with your doctor are essential for maintaining good prostate health. Continuing our discussion on benign prostatic hyperplasia, let's explore another common symptom: urgency. Urgency isn't simply needing to urinate frequently. It's that sudden, overwhelming, and sometimes desperate urge to go, even if your bladder isn't actually full. It's that feeling where you absolutely have to go right now, with little or no time to delay. This intense urgency stems from the same underlying issue as urinary frequency: the enlarged prostate gland. By putting pressure on the urethra, the prostate restricts the normal flow of urine. This pressure triggers your bladder to send out urgent signals to your brain, creating that desperate feeling of needing to urinate immediately. The consequences of urgency related to benign prostatic hyperplasia can be quite disruptive to daily life. Imagine this: you're in the middle of a meeting, enjoying a meal, or driving, and suddenly you are overwhelmed by this urgent need to urinate. You might have to rush to the bathroom, potentially even experiencing incontinence or leakage of urine if you can't make it on time. This constant anxiety about potential accidents can significantly impact your quality of life, leading to stress and decreased overall well-being. Beyond urgency, the pressure from an enlarged prostate can also affect the flow of urine itself. You might notice a weak or slow urine stream, making it difficult to fully empty your bladder. This incomplete emptying can, in turn, lead to urinary retention, increasing the risk of UTIs and bladder stones. The feeling of not completely emptying your bladder is frustrating and can impact your overall quality of life. Have you experienced urinary urgency or a weak urine stream? What strategies have you found helpful in managing these symptoms? Share your experiences and thoughts in the comments below. Your insights can help others. Remember, talking about these issues openly is the first step towards seeking help and improving your health. Let's move on to another significant sign of an enlarged prostate: interrupted urine flow. This isn't simply a weak stream. It's a more disruptive issue where the flow of urine starts and stops repeatedly during urination. It's like the urinary stream is hesitating, sputtering, and struggling to maintain a consistent flow. This interruption often indicates a partial blockage in the urethra, the tube that carries urine out of your body. The enlarged prostate gland is the most common culprit behind this intermittent flow. As the prostate grows, it constricts the urethra, making it difficult for urine to pass through smoothly. This constriction creates a situation where the flow starts, then stops, then starts again, creating a frustrating and often uncomfortable experience. It can feel like your urethra is temporarily blocked, causing you to strain and push to complete urination. It's crucial to understand that this symptom isn't exclusive to benign prostatic hyperplasia. Other factors can also lead to interrupted urine flow. These include infections or inflammation of the prostate, nervous system disorders, pelvic muscle problems, or even side effects of certain surgeries. A proper diagnosis from your doctor is key to pinpointing the cause and developing the most effective treatment plan. Interrupted urine flow can be an early indicator of prostate problems, and it's important not to ignore it. This symptom can significantly reduce your quality of life. Have you personally experienced interrupted urine flow? If so, what strategies have helped you manage this symptom? Share your personal experiences and tips in the comments section. We all benefit from each other's knowledge and support. Remember, talking openly about these issues is vital. Don't hesitate to seek medical advice if you're experiencing any of these symptoms. Early diagnosis and proper management are crucial for maintaining your urinary health and overall well-being. Early detection is key to effective management. As we continue our discussion of benign prostatic hyperplasia, let's explore some less common but still important symptoms. While not everyone experiences them, it's crucial to be aware of these potential indicators. One less frequent yet noteworthy symptom is pain or burning while urinating. This discomfort typically arises from the irritation and inflammation of the urinary tract caused by the pressure exerted by the enlarged prostate gland. The pressure can irritate the lining of the urethra, leading to that unpleasant burning sensation. This feeling can vary in intensity, from a mild discomfort to a significantly painful experience. Finally, while less directly related to the urinary symptoms, benign prostatic hyperplasia can also negatively impact sexual health. Erectile dysfunction, or the inability to achieve or maintain an erection, can sometimes be a consequence of benign prostatic hyperplasia. This can be due to various factors, including hormonal changes and nerve damage. Are there some natural remedies for benign prostatic hyperplasia symptom management? Yes, there are. They include dietary changes, lifestyle modifications, and herbal remedies. A diet rich in fruits, vegetables, and whole grains, and low in saturated fats and processed foods is generally recommended for overall health, including prostate health. Some studies suggest that specific foods might offer benefits, such as tomatoes, soy products, green tea, and fatty fish. Regular exercise helps maintain a healthy weight, improves blood circulation, and can have positive effects on various aspects of health, potentially easing BPH symptoms. Weight management is important since obesity is a risk factor for BPH. Stress reduction techniques like yoga, meditation, or deep breathing exercises might help manage stress levels. Several herbal remedies have been explored for BPH. Examples include saw palmetto, Pygeum africanum, and beta-sitosterol. Before we conclude our discussion on benign prostatic hyperplasia, let's reiterate a crucial point. Not every man with an enlarged prostate will experience all the symptoms we've discussed. The severity and combination of symptoms vary considerably from person to person. Some men may experience only a few, while others might have a more comprehensive range of issues. This variability highlights the importance of individual assessment. If you are experiencing any of the symptoms we've discussed, urinary frequency, urgency, a weak urine stream, interrupted urine flow, pain or burning during urination, or blood in your urine, it's crucial to consult your doctor for a proper evaluation. Don't delay seeking medical advice, as early diagnosis is essential for effective management and treatment. Your doctor will conduct a thorough examination, possibly including a digital rectal exam and/or urine tests, to confirm the diagnosis and assess the severity of your benign prostatic hyperplasia. Based on the findings, they will discuss the most suitable treatment options for your individual needs. These options can range from lifestyle adjustments, such as dietary changes and increased physical activity, to medications, and in some cases, minimally invasive surgical procedures. Remember, Managing benign prostatic hyperplasia effectively is about proactive care and open communication with your healthcare provider. It's not something to be ashamed of or to suffer in silence. What's your experience with seeking medical help for potential health issues? Do you find it easy to talk to your doctor about sensitive topics? Let's discuss your thoughts and experiences in the comments section below. Remember, your health is your priority,